for the Arch National Respite Network and Resource Center. I do want to say that even though this webinar is geared toward lifespan respite grantees and their partners, there are some of you out there who I think, even if you're not affiliated with a lifespan program or a state respite coalition, you will still find the information we present today very helpful, and you will hopefully also come away with a few useful tools that you can apply to your own respite or other programs. Before we get started, I want to introduce Emily Turner, who's our GoToMeeting expert, and she's going to go over the mechanics of the GoToMeeting process today. If at any point you're having trouble with your webinar connection, just please type in your issue in the question box, and Emily will do her best to try to resolve your questions or your issues. Go ahead, Emily. We appreciate it.
Sure. Good afternoon, everyone. I just want to go over a few housekeeping items like Jill mentioned, and due to the high number of participants, all callers will be placed on mute. But during our Q&A portions of the webinar, you may raise your hand when you would like to comment, and you can do this by clicking the hand button on the tab near the top of your control panel. This will notify the organizer that you do have a question, and your line will be unmuted. Make sure that if you're connected by telephone that you have entered your PIN code provided on your control panel under the audio tab. You may also send questions to the presenter through the question box feature on your control panel. Simply type in your question and hit send. We will also be using polls during this session, and when we are ready to launch the poll, a screen will pop up on your computer and you can simply select your answer. And finally, this webinar will be recorded and posted on the Arch Respite website. Participants will be sent an email with a link to the archived webinar once it is available for viewing. That's it.
Great. Thank you very much, Emily. At this point, I was hoping to introduce Greg Link, who's the Aging Services Program Specialist at the Administration on Aging. He is our Federal Project Officer for Lifespan Respite, as well as for the National Family Caregiver Support Program. But he just got called away to a very important organizational meeting for the newly formed Administration for Community Living at the U.S. Department of Health and Human Services. So I apologize that he's not with us to welcome us today, but hopefully we will hear back from him about this new organization at the U.S. Department of Health and Human Services. For those of you who are unfamiliar with Arch, I just wanted to give you a little bit of background. We work in partnership with the Family Caregiver Alliance to provide services through the Technical Assistance Centers for lifespan respite and caregiver programs. And in this capacity, Arch provides training and technical assistance to the 30 state lifespan respite grantees and their partners, including state respite coalitions, aging and disability resource centers, and we also provide training and TA to anyone interested in respite services, including family caregivers who might be looking for those services. Also, it'd be helpful for you to have a little bit of background about the Lifespan Respite Program, if that's something you're not familiar with. It is a federally funded effort run out of the Administration on Aging. Grants are awarded to states on a competitive basis to allow them to establish coordinated systems of respite services so that access to respite is improved for all family caregivers, regardless of the age or condition of the person that they're caring for. At the heart of these coordinated lifespan respite systems are collaborative partnerships, whether that's across state agencies, across statewide disability, children's, and aging organizations in the private sector, or across community and faith-based agencies that are serving all ages and conditions. It's a multi-tiered collaborative effort. The intent of lifespan respite is to maximize use of existing resources, to use these resources more efficiently, and then hopefully be able to leverage new funding sources, again with the goal of improving respite access and service delivery. One way that lifespan respite programs, of course, try to work efficiently and in a coordinated fashion is to first identify all the respite funding resources and services that might exist in their state and bring them together to develop either a single point of entry or a no wrong door entry into respite for family caregivers. To help them in this process, in addition to the broad range of training and technical assistance that we provide, we did prepare federal and state respite funding guides. And we did send the links to these documents to all of you who registered for the webinar today. You should have received them prior to this afternoon. If not, they are available on our website, which is archrespite.org. In these federal funding guides, we identified over 60 federal programs that fund or support respite or have the potential to fund or support respite, as well as over 250 home and community-based Medicaid waivers that fund respite services for various ages and disability groups. In addition, ARCH identified a number of state public funding sources that might be available to either help family caregivers pay for respite or help the lifespan respite programs provide training or other infrastructure or capacity building tasks. The trick now, of course, is to figure out how to access these funding sources, especially in these very difficult economic times, and make the best use of them so that the lifespan respite program is able to serve as many family caregivers as possible, but also to be able to keep the lifespan respite program running after their federal lifespan respite grant expires. We're very fortunate today to we have someone who will introduce us to tools and techniques to assist in this process and help us all on the road to developing long-term sustainability plans. Our webinar speaker today, and we're very, very delighted to have her, Laura Martinez. Laura is a senior program associate with the Finance Project, which is also based here in DC. She holds a Master's of Public Policy degree from the University of Chicago and a Bachelor of Arts in Economics from the University of Arizona. And again, we're very pleased to have you, Laura, so please proceed.
Great. Thank you, and welcome, everybody. As Jill stated, my name is Laura Martinez, and I am with the Finance Project. I'm delighted to be here with you today, and I know how busy you all are, so I'm glad that you could join the webinar to learn more about the Finance Project's framework for sustainability and how it could be applied to your programs. The Finance Project, we're a nonprofit research, technical assistance, and training firm, and we help programs across the nation focus on sustainability and financing. That includes a variety of sectors, from the health sector to children and families and education and everything in between. The overall goal of today's webinar is to help lifespan respite grantees, their partners, and other participants interested in supporting respite in any way think about how to sustain their services in their state. In today's webinar, I will provide a framework that you can use to design a sustainability plan. I will also help you kind of think about and benchmark sustainability and how you could think about your sustainability goals along with your program goals. And at the very end, I'll also provide tools that will help support the development of a strategic financing plan. Through this, I want you to walk away with 3 things. The first is a basic understanding of sustainability planning. I also want you to walk away with a knowledge on how to launch a sustainability planning process to take account of where you are and who needs to be involved. And I also want you to leave with an understanding on how to develop a strategic financing approach as part of your sustainability planning efforts. Now, I know we have a number of various participants with us today, and some are coalition leaders, other are program leaders and network leaders. For simplicity, I am just going to use the program term when I refer to Respite, but I do recognize that each of you are from different locations and have different structures in which you're offering services in your state. So what is sustainability planning? Here at the Finance Project, we believe sustainability planning depends on a clear plan to clarify where you are, where you want to go, and how you're going to get there. And that includes sitting down to develop specific strategies and an action plan to make sure that you're thinking about sustainability strategically. Like Jill said earlier on in her conversation, we also believe that sustainability is about figuring out what resources you're going to need to sustain and support your Respite programs. Some of those resources will be financial resources, money, and others will be technical resources, administrative resources, in-kind resources through donated time and materials or infrastructure support. Regardless of what kind of resources you're looking for, the goal is really to help you do what you do best and to continue doing it over time. So, to go ahead and dive right into the content of the webinar, I want to walk through these 8 key elements of sustainability. The color coordination of these elements is grouped strategically because we really kind of think about them as in kind of pairs or groupings of priorities. The first element of sustainability, and also these could be thought of as characteristics that make a strong, sustainable program, is knowing what program components you want to sustain, having a clear vision. The results focus, or also known as kind of a results orientation, is thinking strategically about using data and sharing that data with the right people. With strategic financing, that's knowing how much your program costs and what resources you have. The adaptability to changing conditions, that really kind of addresses a program's ability to move with the times. What are the changing economic and demographic trends in your state and in your communities? And how do those trends impact your program? And are you ready to adapt to those? The broad base and key champions are also kind of grouped into this category because both the broad base of community support and key champions are going to be the advocates for your program. They're going to create that foundation and that knowledge to help you adapt to changes in your community. And again, we're going to talk about each of these 8 elements in great detail, so I just want to give you a summary now. Next, we have strong internal systems. Now, what we mean by this term at the Finance Project is an internal system is a kind of a fiscal management system, an accounting system, or a financing system, human resources or the personnel systems in place, or even maybe a governance structure if you're a private 501c3. And last, does your organization or program have a sustainability plan? A written plan really tells the story of what you're trying to accomplish. And that kind of is the last key characteristic that we thought of or recommend when thinking about sustainability. As I stated, having a vision is knowing what you want to sustain. For the Respite, Lifespan Respite Program grantees, it's pretty clear. You have a very clear purpose to implement statewide systems and coordinate community-based respite for family caregivers and for individuals with special needs of all ages. So there's a pretty clear focus and mission of what you're trying to achieve. But you also have to think about what is the scope of activities that your program is trying to offer. What is the scale of operations? Now, let me explain the scope of activities and scale of operations. The scope of activities is kind of the breadth, well, the scale of operations is kind of the depth. And what I mean by that is you might offer many, many, many activities, but you have a very small scale of operations, and that's okay. And then sustainability planning is being clear on what those items are. And a timeline. What goals and activities and services do you want to offer and when? Now I'm going to stop right there, and I'm going to call on one state to share a very compelling example that I've learned recently. Java Bennett from Alabama, in a conversation we had, she shared with me an example about how they have stayed within their vision even though it could potentially impact their sustainability goals. Java, are you available to kind of share what you taught me?
I'm here. Can you hear me?
I can.
Yay! I am Java Bennett. I'm with Alabama Lifespan Respite Resource Network. Our network's mission is making respite resources readily available and easily accessible for all caregivers in Alabama. So it is very broad. We have a specific purpose of identifying and developing a network of high-quality respite resources for our family caregivers. Every year, our staff looks at dozens of possible funding for grants. We have a clear vision about what types of activities need to be funded and kind of a timeline that we need those funded. So as we look at grants, we have to look at how that matches up. When we started in 2000, we wrote a specific grant to an agency that funded us in a 3-year grant to start Alabama Lifespan Respite Network. The program was deemed extremely successful by the grantee, and they have called us multiple times over the many years to come in and share our successful program and the grant that we got back in 2000 with their reporting entities. However, just like several of our funding sources, they didn't stay true to wanting to continue funding for respite. They went on to other activities. I think what happened is they thought, okay, great, we were successful for this. We'll just fund some additional things. So you have to really work with the funders to help them understand that this is an ongoing process. But the board of directors, anyway, decided that they would fund other projects besides respite. And through the years, they did fund us a couple of additional times during, they certainly supported our 2006 National Respite Conference we hosted in Alabama. And then about 18 months ago, we got a funding again from them to work with us because we went to them and said, we got the federal grant. One of the things we were going to do in the federal grant, we needed additional funding to make that happen, and they did fund us for 18 months. But she asked me at the time why we did not go for all of the grants that they put out there, usually 5 or 6 a year, and why we never went for those grants. And I was able to tell her that we try to stay so close and so focused on our mission and what it is that we need to do with Alabama Respite to move forward as a lifespan respite state, that the grants that they put out there just did not match, and that for us to stay focused on our mission, we were not able to write for any of those grants. Well, from that, she really listened, and she went back to the board and has talked to them about that being an issue, that when they do support the successful grants, that we're able to do more and move forward. So we're hoping that that will help. And what we did ask is when we developed our statewide coalition, that all of these key players that have funded respite or that have respite or that is a focus participate on our coalition. And so she's a really good partner. And while it wasn't a consistent funding source, we've built a relationship. And I do think that we could go to them in an emergency and possibly get some emergency money to tide us over if we need it. And that's our hope anyway. So that's how we've been able to build the strong partnerships We've been able to successfully move forward in our work, and while we're like everyone else every year wondering, are we going to be able to continue, we may not, but we do have some secure funding that at least keeps us at a low amount of money to keep going forward, where we can continue to seek this funding that we need so desperately. Thank you.
Thank you. That was an excellent example about how staying true to your mission is very important, even if it potentially means foregoing funding. And in this case, it was a very specific foundation, and it was great that you had built that relationship in which you could think about, and the funder could approach you and say, you know, well, what's going on? So I think that the takeaway there is really that staying true to your vision is the first characteristic and kind of element when thinking about sustainability. The next element is being results-focused. And being results-focused really means defining success and measuring the progress over time and being able to share those results. The Lifespan Respite Care Act, again, has very clear objectives, but I know each of the individual states has objectives that they want to accomplish as well, including expanding coordination and participation of their resources or increasing family caregiver access to respite programs. Knowing those objectives, after knowing those objectives, you have to think about how are those objectives, those outcomes, measured through outputs. You also want to think about what other objectives and measurable outputs that you have for the program. So for example, the example on the screen, your outcome or objective could be expand the delivery of planned and emergency respite services, and that could be counted or tracked by the number of family caregivers. The results are very important for sustainability, especially in this day and age, because they can and should be used to report outcomes to funders and other key stakeholders. One state that I spoke to, and I was kind of doing some short interviews on what's taking place out on the ground, indicated that everything that they accomplish goes directly into reports to the funders, if it's required or not. And that includes the number of vouchers per manager, the number of people reached, the number of meetings, the number of volunteers, and the number of volunteer times, just to name a few examples. But they are very focused on obtaining results and making sure that these results are usable and you're able to express them to your key stakeholders. Another element is sustainability, which I'm not going to talk too much about here because this will be the second portion of the webinar today, is just having a strategic financing orientation. And what that means is knowing what you want to fund and projecting the resources you need. It also includes systematically developing a variety of financing strategies and funding sources to provide a stable base of resources all the time. So again, I'm going to talk about this more in detail, but think about this. Do you know what you want to fund? Do you know what funding requests you need to make? And are you seeking a diverse range of funding resources? I won't say resources, both fiscal and non-fiscal resources to support your goals. Next, we have the adaptability to changing conditions. And this includes being proactive in the policy environment and being able to adjust to changing social, economic, and political trends in your state and local communities. So one question you want to consider when you're thinking about adaptability is how do you respond to and predict changes in your environment when planning for sustainability? One challenge faced by a state respite program is that they're currently dependent on state dollars. They currently have the key stakeholders in the executive branch that they've worked with over time. They've educated them on the importance of respite. But what happens when they leave? They're really concerned about when this group of state legislators leave, what happens if the new leaders don't support respite? And they felt like they were going to have to go back to the drawing board. But that's one thing that you want to consider, is you have to consider the political environment and start thinking in advance about those changes. To help you do that, you can monitor announcements about opportunities for funding. You could consider new ways to frame your work. And you could also participate in collaborative advocacy. And many of the state and the state coalitions are already doing this. Another leader shared with me that this is not an easy environment to think about sustainability. Even in the private sector is just recovering. And they provided an example of where they approached 3 foundations at the right time, and they were able to get funding from these foundations, but the next year their portfolios crashed. And that was a few years ago, but now they're just looking again at corporate funding because before this year they were learning in their state many of these corporate funders and foundations just did not have the resources to provide for respite. And again, another strategy to think about to better position yourselves to adapt to the changing conditions is look at the legislative route. Can you get the Lifespan Network written into law? And this has been done in a few states, including Nebraska. If you could get the respite program written into law, that could bring not only money but other resources as well. And then again, that goes into having that broad base of community support. And the next slide, which are key champions. I just walked through the first 4 of 8 sustainability characteristics, so I'm going to stop right there and see if there are any questions at this time. And if you'd like to ask a question, you could enter that to your questions or chat box, or also raise your hand. Okay, well, we don't have any questions at this time, but please feel free to send them in, raise your hand at any time, or also enter a question in the chat box at any time. The next characteristic of sustainability is having a broad base of community support. And it's important to consider whose support you need and develop an approach for involving a community support. That could be done in a number of ways, including developing a brand to create a desired identity, encourage the involvement of the family caregivers and other recipients. You could be heavily involved in public education and engagement, and what I learned is that this actually is a huge part of your jobs and your missions and visions within your respite programs, is really educating people to be aware of what's taking place for respite and the value of respite. And also building partnerships. So for example, one strategy here includes coordinating with other programs and agencies in your state to find loopholes in funding, or even coordinate to be more competitive for additional funding. When I say closing loopholes, I use this example because one state shared with me that they actually use case managers from the Child Welfare Agency to help get family respite in their state. And the biggest challenge I had or learned about is that the process of educating stakeholders on the value of respite, it's time-consuming, and it can be tedious, and sometimes people understand what it is, and other times people don't. So does anyone have an example what you've done to create community support to help in your sustainability efforts? I believe that Barbara Snyder from Delaware, I learned, had a really interesting example for the Lots of Helping Hands program. Barbara, are you with us?
I am. And if I could just frame this a little larger, I'm going to speak to the encouraging involvement of family caregivers, because I think they can be the most powerful advocates for respite. When we've gone to funders, the most articulate people about this issue are people who have needed respite, and whether they're people in agencies or just representing their own family, they are so articulate. So I think empowering families, you know, and involving them, that I shared with, I'm sorry, I'm going blank here, but one, yeah, in our interview, I talked about sometimes I think we miss the opportunity to allow empower families to solve problems themselves. And we found the tool Lots of Helping Hands. If any of you are familiar with it, it's a website that allows families to develop a community of support through a website where they post a calendar where they can list things that their family needs, like they need a meal brought in, they need somebody taken to a doctor's appointment, they need somebody to come in to stay with the person who needs care so they can go out for a night at the movies. And that kind of involvement of families in solving their own problems empowers them and makes them part of the overall solution. So it isn't always about us solving it for them, and that certainly, as we've looked at the issue of sustainability, low-cost options for helping families think about how they can find respite is important. So involving families through being spokespersons, we have members on our coalition, but using resources where they can solve their own issues through tools like Lots of Helping Hands.
Great, thank you, Barbara. That is an excellent example about involving and empowering families. Now, I think that I have a question, if this is correct, from Miramar Rose. Am I reading that correctly, or is that a raised hand?
I believe it's Miriam, and I'm going to unmute her line right now. We just got to find her. Hold on. Miriam, you should be able to speak. Miriam asked that how is the finance project supported?
How is the finance project supported? Well, that's an excellent question. If you don't mind, I'm going to save that until the end. I'll talking about, when I talk about financing strategies and some of the things that we recommend, we also take those strategies and apply them to our own organization. But importantly, we really try to follow the principles and these 8 elements that I'm presenting here today. So I will come back to that when I get to a financing strategy slide and kind of talk about how we also employ those financing strategies in our organization. And thanks for your question. Okay, great. So the next element that I'm going to move to is the key champions. Now, key champions can use their power to influence, to generate support for the Respite program. And the key champions and the broad base of community support are almost one and the same. They're not identical, but they're very familiar because those key champions are those individuals. The individuals that you want to have as part of your program are those that you've already listed as having buy-in and described in your grant application. Some states have developed strong partnerships with state legislators, which could bring additional support, or other prominent individuals in their communities. When speaking to the one state, they indicated that recognition and having the recognition of the good that they're doing, and that those key champions and those key stakeholders in their community and state know that they're getting good bang for their buck is an important part of their sustainability. They said because people have seen their work and know what good it does, and that the Respite program itself and the state could demonstrate what they've accomplished, that these key champions keep supporting the Respite program time over time and are their #1 advocates for the program in the state. One of the challenges with fostering a group of key champions is, again, the education component. Educating your key champions on the value of Respite, which includes your caregivers themselves, requires a lot of time. So when you think about cultivating a broad base of champions, your elected state and city leaders, your staff and volunteers, and even your Respite recipients, you really want to think about the strategies in place in which you could best involve them. And like I stated earlier, this is a key program component of the Lifespan Respite program within itself. So many states already have a number of key champions and a very good solid broad base of community support. And when we get into the strategic financing section, we'll just talk about examples and making sure that those partnerships are actually providing resources if possible. The next element is having a strong internal systems. And again, when we refer to strong internal systems, that kind of means having those fiscal performance management systems in place and that you're involving the right people to help you carry out your work. So it's really thinking about, do you have the organizational capacity to reach your goals? And do you use those strategies, those systems, to review strategies, document outcomes, track and monitor the costs and the resources of your program, and make changes as needed? One strategy that I learned about is kind of having a system among many agencies. So for example, in Nebraska, the Respite program kind of sub-grants activities. They get almost $75,000 for administrative activities such as salary to other agencies. So they kind of sub-grant their activities. And one state leader in Nebraska is responsible for the oversight of each agency, making sure that they provide technical assistance and also offer a hotline line, which I learned that many states are actually doing this. They also, within those sub-grants and the larger grantee, they work together on the public awareness campaign. And they also make sure that this public awareness campaign and this message is shared among other agencies. And that includes the brochures, hosting conferences or workshops, or setting up information booths for families. So it really is, in Nebraska, they do the best they can to kind of coordinate what is taking place in each area. It's a very large state, and so they try to, break up their activities by the eastern side of the state and the western side of the state. And for example, if you are in a locality within the state of Nebraska and you call the 1-888-866 number, there's a central call system in which one person will answer the phone and then distribute this caller to the right Respite locality. One thing that I spoke about with the state leader, though, that's kind of a challenge in that system is now cell phones. With cell phones, people could have various area codes, but now that's getting a little harder to manage. But the reason why I shared this example again is because there are many activities and services taking place, and the coordination of those services and the coordination of those internal systems all working together to accomplish a vision could be really powerful. Another state I spoke to kind of said that this model was the ideal model of running the system under one agency, such as the Division of Aging. And that's been done in many states, including Oregon. So, but it's not a reality in all states, and it's not maybe the most beneficial structure depending on what your sustainability goals are. And so, for example, it might be in your state be more beneficial to be a 501c3. So there are a number of internal systems and structures available that could help with your sustainability goals. You just have to make sure that you have those internal systems in place and you know how they interrelate. The last element that I'm going to describe today is the sustainability plan. And this might not be a new document. Some of your programs may already have a sustainability plan that's kind of embedded into a larger network or coalition, or maybe even into a statewide plan. And if you already have a sustainability plan, maybe you just need to modify or expand what it is that you're trying to accomplish within the sustainability plan and make it a little bit more clear. But the purpose of the sustainability plan is to gather a numerous information about your programs, your program's history, the goals and objectives, also your examples of your planned activities and the role that your state respite coalition plays into a clear, compelling, and convincing document. And this is a written document. Your sustainability plan shouldn't be, written and then put it on a shelf and never looked at again. It's really a living document, and it's best used when it's reviewed and updated periodically. So what does the sustainability plan do? It could define and develop and takes into account your short and long-term needs. It identifies challenges and obstacles and strategies to overcome those challenges. And it also should identify who your key partners are and how you're working and communicating with those key partners. So those are the 8 elements of sustainability. So I want to stop right there, and I want to ask you, after reviewing and thinking about those 8 elements, which of the 8 elements of sustainability is a particular strength of your state respite care system? And we've actually grouped these into kind of a couple of categories, and we've left out sustainability plans for various reasons. So I'll give you a few minutes to answer. Where do you feel your program already excels?
I'll leave that open just a few more seconds to allow everyone to participate. Okay.
Great, and it looks like Emily has put the polls up for having a broad base of community support. The majority of you have selected this option, which is not surprising, followed by having a strong vision and results. Most people don't feel like they're particularly strong in a strategic financing approach. So hopefully this webinar is on target and will help you kind of think about and develop that approach to best support your organization. So what about on the flip side? If you know and have an understanding of where you think you excel, what of the 8 elements grouped into the same groupings that you just saw do you feel like you need to have improve on? Where might you need to build capacity in these same areas? We'll give you just a few seconds to think about the question and respond.
Okay.
Okay, great. So it's no surprise that on the flip side, you feel that you might need to build capacity in the area of strategic financing. And a few of you felt like you could still use a little bit of improvement upon developing a broad base of community support. So understanding where you need more capacity building could help you develop a customized and effective sustainability planning approach. And we could help you do this. And after this webinar, we will provide the Finance Project and ARCH a suite of tools for you to use. And one of those tools that we're providing to you includes the self-assessment tool. So what we just did is what we call kind of this quick and dirty self-assessment. Just like a snapshot without much strategic thinking, where do you think your programs align? And you probably don't have to think too hard about where you're strong and where you could use improvements, but the self-assessment can help you assess where you are, identify your strengths and weaknesses, and also help you determine where your planning time would best be allocated. The quick and dirty results that we just did, so kind of the strategic financing approach. So the purpose of this tool, which again will be available through ARCH, is it includes questions about your progress in the 8 elements. Some grantees will have made a lot of progress on some of the elements and less progress on the others, and that's okay. Because this tool, when working on it together with the team, helps you prioritize different areas of work within your sustainability goals. And the purpose of this self-assessment tool is not to grade you on anything. It's really to take stock and an inventory of where you are. So for example, if you gather a sustainability planning team, you're going to be asked to rate where you are on a scale from 1 to 5 and how much progress has been made. So the first example here is for the vision, and that includes, have the initiative leaders developed a clear vision for their work? We would expect, and as we just saw in this kind of quick and dirty assessment, that you're going to score yourself fairly high on this question because the lifespan programs have very clear objectives of what they're trying to accomplish. However, as you go through each element, and this is a very long document, it's about 11 pages long, this will help you think about where you really stand and if other key stakeholders and key champions of the Respite program agree. And again, it's really used to help you prioritize your work. So to complete the self-assessment tool, we recommend developing and assembling a planning team. So what is the purpose of a planning team? A planning team is where you will gather yourself and others because more opinions are better than one To help you think about sustainability and think about the respite programs and services that you're trying to sustain and how they could help. So in developing a planning team, and it could be called a sustainability planning team, you want to invite your key stakeholders to participate. And that includes both internal and external stakeholders. The internal stakeholders could include those already involved in the respite program, or those that you've described as key players or maybe even partners in your lifespan grant application. The external stakeholders you want to think about including are those with influence, such as state legislators, those with information, like someone with expertise in respite services or knows the history about the respite services and program in your state. Or maybe even you want to include a potential partner, those working towards similar goals and have cross-cutting priorities. And those could be partners including someone from the Department of Health or Human Services, Child Welfare, or Mental Health. In assembling a planning team, you want to set an agreed-upon meeting structure and schedule. How much time do you need to accomplish developing a sustainability plan and developing some action items to help you reach your sustainability goals? How much time can your leadership group, this group of key stakeholders, afford to commit to sustainability planning? And are there any external factors driving the plan, such as a grant date ending or changes in your respite program or your state program or state leadership? And you also want to think about what resources you need. Do you have the staff time to plan for meetings, prepare for drafts, and communicate with key stakeholders about your sustainability goals? From our experience at the Finance Project, sustainability planning usually takes about 3 to 12 months. There's always I guess there's never a right time or a wrong time to start sustainability planning. That time should kind of always be now. But you want to think strategically about kind of setting up a meeting structure and really how that's going to align in accomplishing your sustainability objectives. Next, you want to assess what strengths can build upon to address those areas of improvement. And this information will really be discovered in the self-assessment process itself. Today we learned that that's in strategic financing. And you want to develop a work plan. And you want to consider the planning work that is already being done and also potentially breaking up any planning work by a mixture of small group or large group meetings. Sustainability plans that are written without the key players need to implement them rarely go far. So you want to include not only those key stakeholders that have information, influence, and are potential partners, but you also want to include the key stakeholders that have the power to adopt any plan or any financing strategies that you've developed. So, before I move on to specifically talking about the strategic financing approach, which we learned today would be very valuable, I'm going to pause for a few seconds to see if there are any questions. Again, you could either raise your hand through the raised hand function, and Emily will call on you, or you could type your question into the chat box.
I have a few that came in through the question box, Laura.
Great.
Have any states been successful in getting employers to support respite?
Is there more specific about the employers, the organization's employers, or maybe employers like businesses and corporations in the local community?
Okay. Well, hopefully she'll respond back and let us know.
Okay. Well, oh, okay. Go ahead. You go to the second question first. I'm sorry.
What strategies?
Can I be heard? It's Jill.
Yes. Hey, Joe.
For that last question around employers, I would refer people to a very recent report that the National Alliance on Caregiving just produced on employer involvement around caregiving. And they did cite one example, if I'm recalling correctly, of a program, I believe it was Johnson & Johnson in New Jersey, that as part of its comprehensive package of caregiver supports does provide a certain number of hours of respite that they're actually paying for their family caregivers. And I think I sent a link around to that employer study last week. If you didn't receive it, just send me an email and I'll send that link on to whoever was interested. We hope to do more in this area also.
Great, thank you, Jill. That was very helpful, and it also helped clarify the question. So when you're thinking about involving local employers, such as those businesses, one thing you want to do is, again, you want to make sure that they feel educated and that they're familiar with the value of respite care and respite care services. So there's a strategy often that you're probably very familiar is tugging on those heartstrings. And in doing so, you want to try to set up and connect with that employer. In person is always better, but sometimes just a phone call or a letter of interest would be helpful. And you want to really describe and educate them on the value of respite, why it's important, and actually have a specific strategy or an idea of how you want that employer to be involved. Again, it could be through volunteer hours or maybe kind of in-kind resources, something that the respite caregivers could use. But really the best strategy is to meet with them, educate them on the value, and be persistent. You have to have tenacity and just really go for it and stay strong in making people understand how that could potentially impact them, if not now, in the future. So I hope that helps. Emily, you said that there was another question.
Yes. What strategies have you seen that help encourage family caregivers to get involved?
Perfect. So this is another excellent question, and I'm going to again save it through the end because we're going to end this webinar kind of talking about these strategies and how we could involve people and educate people on what and why it's important to support respite, and also hear from a couple of other state leaders. So thank you for sharing that, and I will also readdress this towards the end. Okay. Are there any other kind of questions at this time that are maybe specifically around the 8 elements of sustainability, the self-assessment tool, or assembling a planning team? All right. So for the last half an hour, I am going to walk you through developing a strategic financing approach, and this is the most critical and technical information you'll need in thinking about sustainability for your programs. So what you see in front of you is a straightforward set of questions, but they're very important. By answering these questions, it helps you understand your fiscal and non-fiscal needs, and it kind of helps you to target your fundraising and development efforts. And I also would add partnerships. So the first step is identifying what you want to sustain. Again, that's pretty straightforward for most of the participants here today. But then you want to think about and ask yourself, how much does it cost? How much does it cost to support and run the respite services and activities that I'm trying to have? The next step is thinking about what resources you currently have, and what are those resource gaps? What is the gap between what you have and what you need? And last, and we've already received a couple of questions around this, is how can those gaps be filled? What are the best monetary and non-monetary sources and strategies to best suited to fill your gaps in your respite programs? So having a strategic financing approach, there's a number of purposes. Most importantly, it links the cost and resource estimations to the goals defined in your program plans. It could help identify and really pinpoint a range of fiscal and non-fiscal resources needed to support your programs. It can help you align your fiscal resources with the activities and services that you want to finance and sustain. And it can also help clarify and prioritize which financing strategies best match your goals. So how is this done? First, it's clarifying what you want to sustain. Again, it's talking and thinking about the scope of your programs, the scale, including the staffing, the standard of quality, and program coordination. It includes thinking about the scale of activities and services. Within, when you were developing your lifespan respite grants, if you are a grantee, you've already done this. You've already defined the scope of your program and the scale of those activities by identifying what your project objectives are and listing examples of what planned activities you have. But if you haven't done so already, and for everyone on the line, you also need to think about your ramp-up assumptions. What are you hoping to achieve next year, this year, or 5 years down the line? And what are those benchmarks? How do you know when you could grow, when you need to scale back, or when you just need to continue maintaining the current services that you have? So what is an example of this? What is this worksheet? Again, it will be provided to you after the webinar in its toolkit. And this worksheet will specifically lay out and help you think about what scope and scale of programs and services that you are trying to offer and sustain and when. So in the first column, you'll list the services and activities you want to sustain. So for example, one of the activities could be setting up a toll-free respite resource phone line. However, within that, you want to set up the toll-free line, but you also want to create a web-based respite resource directory. So those would be two of the activities. In the following columns where it lists year 1 or year 2, you would want to make those years specific to when you're thinking of your planning. And you want to list the scale in which you're going to offer those activities. So for example, you set up the toll-free respite resource phone line. Well, maybe you only have 1 phone line, or maybe there are 3 phone lines, or there's 1 call center, or maybe there are 5 call centers throughout the state. That's the kind of the information that you would include in the columns year 1, year 2, year 3. So for example, in year 1, maybe you are setting up the respite phone line with 1 phone number in 1 location. But in year 2, you want to grow to a regional-based approach and have 2 phone lines or 3 phone lines within multiple locations. And then in the last column, you want to include over what time do you want to sustain this? Is it 5 years? Is it for 10 years? What happens when landlines become obsolete? Are you still going to have cell phone lines? Are you going to make an internet or an email line? So that's the kind of information that you would want to include. And like I said, many of you have already done this, but it's the very, very first step. The next step is estimating your fiscal need. When you estimate your fiscal need, this really provides you with a clear understanding of your funding needs over time. That includes thinking about your existing services and how those will be continued into the future. And you could gather that information from your current budgets. And for new services that you're thinking of offering, you could use benchmarks. You also want to think about your cost escalation assumptions if you're adding new programs. Do you have new program costs or new infrastructure costs? What if there are changes in staff salaries or other cost of living adjustments? So you really want to estimate your fiscal need over time and take into account a number of factors. The goal is just to develop a realistic cost estimate based on assumptions, but it doesn't have to be perfect. And oftentimes, people feel that the cost of a program is the same amount as the budget of their program. And this is kind of true, but it's also a bit of a myth. Because, for example, if you're a respite program embedded within an agency, say the Department of Aging, for example, even if the Department of Aging is covering all your overhead and administrative costs, in addition to staff salaries, those are still costs. When you think about costs, you want to think about costs of what happens if everything were to go away and I still want to sustain the service. Under the Lifespan program, the AOA funds no more than 75% of the project's total cost, which means that the applicants must cover at least 25% of the project's total cost with non-federal resources. So where are those resources coming from? And how much do those activities cost? So where's that gap? So before even getting started and thinking about sustainability and estimating your needs, if you're a Lifespan Respite grantee, you already know that you have a 25% funding gap that you need to fill. Again, the Finance Project has developed a worksheet for you to help you kind of calculate and identify the costs that are related to your respite program. In this worksheet, again, you list all of your assumptions up top, the type of activity that you are trying to sustain. Perhaps you want to include the number of caregivers served or the number of sites. Definitely you want to include the time frame, but kind of any information could go up top that will help you adjust your costs and think about costs in a way that makes most sense for you. The worksheet down below then provides a few examples about the costs, and here we just listed the startup costs. You might have planning or community assessment costs, or staff or volunteer recruitment and training costs, or maybe equipment and supply costs. And those could happen at the startup level or even when you're just trying to maintain your basic programs. So most of you on the phone today, your respite programs have a variety of structures. Some may be very formalized, or some within, house within another agency or department, while others might be 501c3s. So when you're thinking about the cost of your program, you also kind of want to take into consideration what is the structure in which you're coordinating your respite services, and are there any additional costs that may not be directly going to you, but to someone else. Are there any questions regarding estimating the fiscal need and kind of identifying the cost of the respite programs and services? Okay. Great. And again, those could be typed into the chat box, or you can raise your hand at any time. So we've done two things already. We've identified what it is we're trying to sustain. We've estimated how much it costs. Now we need to know what resources do we have to support that. So what are your current funding sources? And that includes both cash and in-kind resources. You want to think about how flexible are those resources. Are they restricted to specific activities? Or can they be redirected to other purposes as needed? So for example, maybe you have a service delivery model in which you provide vouchers to families, and also you have a set amount of overhead. And maybe if you could get your overhead covered from a different funding stream, you could give more dollars to kind of the direct service component. And I'll talk about more about that in a minute. But really the point is to think about, are there restrictions and can that funding be redirected? How durable are the resources? Are the resources? What time period are they available? Are they time limited? Will they automatically be renewed? So for example, if you have a 3-year grant, will it be renewed after 3 years? Do you have to reapply for funding after 3 years? Or maybe you're not even eligible for the funding after 3 years. And how robust is the project's overall funding mix? And this really speaks to the diversity of your funding portfolios and having that right combination of public dollars, private dollars, and other sources. So like I stated, the lifespan grantees are required to provide at least a 25% match. So what resources do you have to make up for that match? Where are those additional resources coming from? And what resources do you have? One advantage of being a nonprofit organization is you have the ability to fundraise as a nonprofit. And that can include getting private donations directly or even hosting fundraising events or gathering individual donations. In Oklahoma, interestingly enough, I learned that their Department of Human Service, in which the Respite program is based, they have their own foundation. Now, I've never heard of a public agency having a foundation before, but it is possible, apparently, and done in Oklahoma. And within this foundation, people could donate to the foundation, and those funds could be earmarked to specific purposes. So when thinking about financing and strategies, that's kind of one strategy that you want to take about when thinking of your resources. What other opportunities may be available that you're not aware of? So I talked about a lot about where are these resources coming from, needing to make a match, and the importance of having a diverse funding portfolio. So I want to hear from you now. What 3 sources of funding support your lifespan program other than the federal lifespan grant? And again, I'll just give you a few seconds to think about this and answer it. What 3 funding sources? Okay, Emily, do we? Wow, this is fantastic. So people responded that they primarily have state funding and in-kind resources, which is great, followed by closely with private grants and fundraising and individual giving. So that's a fantastic mix, and even 17% of people responded that they received federal funding other than the Lifespan program. So you're already thinking and tapping into the diversity of your resources and really thinking about how that mix is important to your programs. And when you understand this mix, it's important to put it down and really identify it, because the information that you report on your resources will be key in helping in the last part of the strategic financing approach, which is developing a gap analysis. Again, this is worksheet number 3, so it is a series of tools made available to you in which you'll actually identify and track what those resources are. So again, in the first column, you will list that activity or service that you're trying to offer or achieve. Then you'll list the funding source. So for example, that might be a private funding source. That could be some foundation dollars. You would list the level of support, some information about when that funding ends, and also you want to include any notes on restrictions on funding or other funding detail, and also you want to include both your confirmed and likely funding sources. Now, this may vary for everyone. My rule of thumb is that if it's 75% likely, I will list it, because that's a pretty good probability that if you're 75% sure that you're going to receive a funding source, that's going to come in. Doesn't happen all the time, and sometimes things fall through the cracks. But note of that, those that are highly likely, list them as available resources, because that will help you think about a gap over the long term. So I mentioned this word a couple of times already, gap. What is the gap? The gap analysis is taking those current resources that you listed, those total levels of support by a certain year, and subtracting the estimate of your cost for that same year. So it's your resources minus your cost. And we call it a gap analysis, but you actually might get a surplus in some areas too. And the purpose of this exercise is really to help you pinpoint the nature of your program's funding needs. It really is meant to help you assess and prioritize which funding sources represent the best targets or opportunities given your specific needs. And it really helps you think about the goals and activities you want to sustain and where you have money for those goals and activities. And it also helps you think about a time frame and how long those resources will last, and when are you going to see decreases or increases of your funding and have a larger fundraising goal. On the other hand, a surplus can demonstrate a potential opportunity to reallocate funding from one category to another. And so what does that worksheet look like? The last worksheet in your series of 4, the self-assessment is a great supplemental tool to help you identify where you are in your sustainability plans, but the 4 worksheets I just presented to you are the 4 most critical worksheets on thinking about strategic financing. So again, you already have this information because you've completed the previous worksheets. You'll list in the first column that major service or activity you're trying to sustain, the cost of that service and activity, the resources you have available, and your gap or surplus. And then, of course, that will correspond over time to the years that you've identified. So finally, if you will, that takes us to kind of our concluding conversation, which I think you will find extremely valuable, is identifying the financing strategies. So it's really taking what you just learned from your gap analysis and matching financing strategies into specific kind of categories or areas. So this could really help you clarify what you need and when. It could help you understand if you have the right mix of fiscal and non-fiscal resources. And you should also think about your program's ability to adopt a new strategy. So I'm going to go over the goal of each strategy and then provide an example of each. And we also have two state leaders with us here today that are going to share examples of the strategies that are working within their states. So strategy 1, make better use of existing resources. The goal there is really operating more effectively and efficiently with existing resources. Now, that can mean reallocation, but it could also mean implementing low-cost financing options. So, for example, in Oklahoma, they have a paper voucher program, and this year they're going to have an electronic voucher program in which recipients will get family caregivers, will get preloaded debit cards in which they could go to the ATM, enter a PIN number, and then pay the respite provider. Once that voucher amount, that funding amount runs out after a couple of months, they could reload the funding through the ATM or directly into the card, in which then they'll go to the ATM again, instead of having the respite program in Oklahoma send a paper voucher. So really their goal is to try to become kind of a paper-free state. And by moving the administrative costs and burden of having paper vouchers, they're saving a lot of money by putting everything into the debit card program. And they're also saving money on materials and the mailing time. So that's kind of one example of operating more effectively with existing resources. And in the meantime, you're actually saving resources because you're reducing those administrative costs, those material costs, and the time to mail. Delaware, we have Barbara Snyder on the phone with us again today, also has a pretty cool example that she's going to share with us about using an alternative low-cost option to make better use of existing funds. Barbara, are you with us?
I am. Delaware Lifespan Respite Network, fortunately, I think, began with private dollars, which allowed us a great deal of flexibility in designing our system. And as part of our funding respite, we set up a system that allowed families to choose when, where, and who provided respite service rather than using contractors, as many of our state agencies do. And over time, what we have found is that the majority of our families have become very adept at using the money that they receive and are often using friends and family rather than agencies to provide the service. And because they're doing that, the cost is just, the average cost of an hour of respite care that we're paying for is $6. So the families themselves are sort of driving that low cost because they are given a limited amount of money and they're looking for ways to make it effective. And there are other advantages to allowing people to use friends and family, but it certainly does end up being a very cost-effective system. And in fact, our state, when we ran out of our private dollars, gave us some money from their state coffers that were being used. They had been given to contractors to provide respite, and they knew that by the end of the fiscal years they weren't going to be used. And I think it was emblematic of their sense that the system we had set up was cost-effective and also met the family's needs. So a win-win.
Great, thank you, Barbara. That's an excellent example. The next financing strategy that is not going to be new to anyone is maximizing federal, state, and private revenues, and that is simply obtaining and reapplying for funding. That could also include seeking out partners and funders that may not be service-oriented, but can support the organization in a new way. And so, for example, in Alabama, their Department of Mental Health gave them $100,000 to provide respite to mentally needed adults and children through a voucher program through another department. I believe it's the Department of Child Abuse and Neglect. Strategy 3, which many of you are already familiar with, but that could potentially include looping in those employers or those family caregivers, is forming partnerships. And you want to form partnerships that are aligned with the respite program services and your goals, and that it could include both businesses or maybe individuals. One strategy there that I thought was really cool is that in one state, they received a federal grant directly from the Corporation for National and Community Services for the Senior Companions Program. And the focus on the Senior Companions Program is on senior volunteerism. And through this program, they were able to tap in volunteers to volunteer in respite situations. So even if your program isn't funded directly through the Corporation for National Community Services, there might be a Senior Companions Program available in your state or in your country to loop in, or country, pardon me, in your county to loop in volunteers. The next strategy is create more flexibility within the existing funding streams, and what that includes is working with partners and other state leaders to create more flexibility through advocacy and communications, and also kind of a lot of pushing on existing streams that may already be available that the respite program could tap into, and for example, maybe through Medicare or child care dollars. The last financing strategy is finding consistent and finding consistent revenue streams. So that's new and creative revenue. An example that I learned from one state, they actually had an interest-bearing account. And when interest rates were higher, they maybe made $3,000 a year off of interest, which would serve 5 additional families. So if you haven't thought about an interest-bearing account yet, maybe that's something your program would like to set up. You may as well want to consider a year-end appeal or an annual letter campaign. And Jennifer from Tennessee actually is kind of taking the social media online approach to finding consistent revenues. And I'm going to have her share with us that example just really quickly, and then we'll close maybe just 3 minutes late. Jennifer, are you there?
I am here. I'm here.
Great, thank you.
Okay, wonderful. Thank you so much. Well, if any of you like the Tennessee Respite Coalition's Facebook page, you probably were inundated with posts just earlier this month. We actually partnered with Groupon, which they have a newly developed arm called Groupon Grassroots that that sponsored a Groupon for us. So for a week, the Tennessee Respite Coalition was featured nationally on the Groupon Grassroots page, and then also in emails going out through the entire Nashville subscriber network to people that subscribe to the Groupon emails to donate $5 to sponsor an hour of respite for a family caregiver. And we experienced such a wonderful volume of response to this campaign, as well as being able to capture the information from several people that we may not have heard of before. They're new donors. We had donors in multiple different states: Michigan, Illinois, California, people that have never heard of the TRC, but are dedicated to respite found our opportunity, and we're able to give an hour of respite to family caregivers here in Tennessee. So, so using social media and getting the word out really does help.
Great. Thank you. Well, thank you, everyone, in all of the states that have shared examples today. I know that we just barely touched the tip of the iceberg with all these financing strategies and the examples that are taking place in other states. However, you know, I am available to take additional questions. I know that we're at 4:30, but I'm happy to stay on the line and respond to questions over the phone or through the chat box if you haven't got your answered question during the webinar series. And here in front of me, I just have a kind of a resources for some technical assistance centers available online. And then both Jill and my contact information. So if anything today was not answered, or you're looking for more information, both Jill and I are happy to respond. So Jill, I'm going to let you say a few words, and then, like I said, I am available to stay on the line if there are any additional questions through the chat box or the raised hand function.
While you're typing in those questions or raising your hands, I just want to thank all of you. We had tremendous participation today, and thank all of you who stayed on. A significant majority stayed on for the full hour and a half. So I hope we provided you with this introduction to a framework for sustainability. I know that it generated a lot of great ideas for me on issues we can follow up with all of you. So please send us your thoughts. Also, as soon as you disconnect from the webinar, an evaluation that'll take you just a few seconds to complete will pop up, and we hope you'll take those few seconds to let us know what you thought about today. But please also email me if you have thoughts about particular funding sources or issues you'd like to discuss in more depth. And thank you, Laura. That was a fantastic presentation, and we look forward to doing some more work with you as we help our states keep going with their lifespan.
Great, thank you. I'm glad I could help. It's a lot of information in a short period of time. So please, if there are any questions, please send them directly to me now during this webinar period or after the webinar is over.
Thank you, everyone, very much. We appreciate your time. Thank you, Emily.
No problem.
And
I have a few questions that came over the chat, and I do have a hand raised, Laura, if you want to take a couple questions.
Perfect, that would be great. Why don't we start with the hand raise?
Sure. Hey, Susan, I've unmuted your line. If you're able to ask your question, you can go ahead. Okay. It looks like she's unable to ask, so I'm just going to go to another question through this question box.
Okay, thank you.
Let's see. So this goes back to one of the states that spoke about having caregivers share resources and tools. Is there a website where they can find more info on that? I'm not sure which state, and she wasn't either.
It might have been Delaware. I don't know if we still have Barbara on the phone with us, but I know she had a great example of the Families and Friends voucher program, in which they provide $500 to families, and they decide when, where, and who to give the money to. And I know if you go to the ARCH website, there are some excellent program descriptions and links directly to each respite state's website. So I don't have that off the top of my head, but it is available on archrespite.org. And I believe on the left-hand column you will see state profiles. And if you go to the website, you can look for that program. It's called the Families and Friends program, I believe.
Is it in the suite of tools, is there an assessment that can be used by committee members as to the purpose of their committee?
The purpose, the survey that's available, the self-assessment survey that's available online, is meant to be conducted by committee with a specific focus on financing and sustainability. So if the committee itself is focused on financing and sustainability, the self-assessment will be the perfect tool for them. If the committee focuses on maybe other activities not directly related to sustainability, it might be a little less helpful. But it doesn't mean that when assembling a planning team you shouldn't include those people, because they might have different perceptions about the vision or key champions and the progress that the respite program is in those areas. So kind of two-pronged, the self-assessment might not directly be relevant to those committees. However, it is important and relevant to all interested parties of the respite program. So I hope that helps.
We are considerably over our time here, so
Yep.
if there are any remaining questions, we will respond to them as long as you've identified yourself or sent us an email so that we can get back to you individually.
And
Great. Thank you, Jill.
I do have all that information, Jill, so I can send that over to you.
Great. We'll make sure everyone's questions get answered.
Great. Thank you, Jill, and thank you everyone who joined us today, and especially thank you to those at ARCH and the states that provided such valuable information to share with everyone.